Good afternoon, everyone. Thank you for joining us at Incorporating Health Equity and Comprehensive Plans Multi-Sector Approach. This is an hour-and-a-half presentation that will run till 4:30 Mountain Time, 3:30 Pacific Time. And it's worth 1.25 credits for those of you who are AICP certified. We have a great session for you all today. I'm really looking forward to this one. As a transportation planner, health and equity are two topics that we've been really working to try to incorporate into our work more lately. So I'm excited to learn from our presenters today. They represent a range of positions in both the public and private sector and other organizations from all corners of the state and beyond. And with that, I will turn it over to Kendra to introduce our panel and to get us going. Thank you all for coming.
Thanks. Yeah, thanks, Nick. Hey, for everyone on, we have a poll for you because we would love to know who's in the room. This whole format's a little wonky. If you can see us, we can't always see you. So we have a poll out there to learn a little bit more about who's in attendance. So if you can jump over to the poll in Whova, if you could complete that. It looks like we've had quite a few responses so far, some 20-some responses. So if you can go in there, and I'm going to have Nick even show the poll results so we learn a little bit more about you all in the room. So I'll give you a couple seconds here to complete just a 3-question poll. It's really easy. Yeah. Do you want to go ahead and show the results, Nick, or show the Whova screen?
Yep.
For the poll.
Let me get that up here. So there's your first one.
Hey, how familiar are you with connecting built environment? So the bulk of the people are somewhat familiar in there. That's great to know. Okay, experience in the planning field. Ooh, it ranges all over. Kind of all split between under 5 and over. Okay, then who's in the room? Your position. Ooh, predominantly public sector. Okay, smattering of private. Awesome, thank you. That helps us know who's in the room as we start to talk here. So a little bit about this talk. So you're probably wondering, why Blue Cross of Idaho? Why were we a sponsor of this conference? Why are we even sponsoring this session? Well, we're really dedicated to giving back to Idaho and looking at the root causes to health, or known as the social determinants of health. Something that we have done since about 2013 is we've worked with communities all across Idaho and really helping them build a healthy communities. We've worked with local elected officials, we've worked with the city staff around these topics, and we really started to understand how comprehensive plans are the foundational document in long-term planning. And if we really want to start to focus on transformational, sustainable changes that impact community health, we have to start with those foundational documents like comprehensive plans. And this was actually a dialogue that Lisa Ailport, who's on this panel, was one of the first that started with us when we were working with Bonners Ferry. She said, you know, if we really want to make sustainable change, we got to start looking at some of these planning documents. And so in early 2009, we actually started a pilot with the city of Driggs to incorporate health into the comprehensive plan that they were working on. We have a good relationship with the city of Driggs, and they were willing to be a guinea pig on this. And then at the same time, there started to really be this national movement around incorporating health and equity in comprehensive plans. And in June of 2020, the American Planning Association actually released a toolkit that focused on exactly that, of health and equity in comprehensive plans. So there's really been this bubbling and this movement happening around this topic. And I think there's a local consultant one time that I heard him say, public health and planning are on this crash course of merging together. And the two were so interlinked and have been actually from the beginning of public health that now they're re-emerging as we're seeing a lot of the chronic conditions that we're seeing today and the impact that community design can have on those chronic conditions. So I'm really excited to host this panel today. I'm actually going to introduce our panelists and then hand it over to them to talk about this. I'm going to pull up their bios here. I looked at them really extensively, but I want to make sure I get everybody's bios correctly. So first we have Eric. Eric is with Change Lab Solutions. I'm really excited to have Eric. He's our national expert on this, and he focuses on the links between built environment and health. He conducts research, prepares strategies, develops tools to help communities support health, equity, and sustainability. Prior to joining Change Labs, Eric worked for 13 years as an urban design consultant. He's led multidisciplinary teams on streetscapes and public space design, district and corridor restructuring, city planning, and downtown revitalization projects. He's presented on a wide variety of audiences on a range of urban design topics, and we're going to really excited to have Eric talking about health equity in comprehensive plans. Our next panelist is Lisa Ailport. Lisa is with the City of Bonners Ferry. Lisa has spent her professional career assisting cities and counties in Idaho to plan for growth. Her career started in 2003 at the Bonner County Planning Department, where the basic planning principles were applied in growing rural counties. After 4 years with Bonner County, she branched out into the private sector, where she assisted private and public sector clients navigate and developed good planning practices. That was where she started a very successful planning practice and assisted rural, smaller communities and county with their planning needs. After 10 years of working in the private and public sector, she moved back with the City of Bonners Ferry as a city planner, and in 2018 became the city administrator. And from there, she's been building on the principles of planning and bringing those under the areas of city governance, such as economic development, policy development, code reform, utility planning. And Lisa prides herself on being recognized for the work that Bonners Ferry is doing to develop strong community that balances the needs of the current community with those of the future community of Bonners Ferry. So I'm excited to have Lisa talk about the journey that Bonners Ferry has been on. Next, we have Leanne. Leanne is with the City of Driggs as a planner and now serves as the Planning and Zoning Administrator. Through her role as administrator, Leanne works to promote and enhance the character and quality of life of Driggs by working closely with applicants, engaging the public, and raising awareness on planning issues and opportunities. Leanne holds a Bachelor's of Environmental Studies, a Master's of City and Metropolitan Planning, and a Graduate Certificate in Urban Design. I'm really excited to have Leanne talk about the Driggs new comprehensive plan and how it incorporated health. And the last but not least panelist is Christy. Christy works with Logan Simpson. She's been there since 2012 as a community and environmental planner and has been utilizing her background in planning and GIS to identify targeted land use opportunities for upwards of 80 Western communities, which is really impressive, Christy. Christy excels at supporting multidisciplinary plans that balance natural and human health. She's passionate about engaging the public in conversations about where they live, learn, work, and play to generate plans that support a positive future. She's also adept at communicating technical aspects to a variety of involved parties, right? So bringing things down to the Reader's Digest level. Christy's education includes a Bachelor's of Environmental Design, Master's of Landscaping Architecture, and has a GIS professional certification. So Christy's going to be talking about Logan Simpson's journey and how they went in and engaged the community around health in Driggs. So I'm really excited to be kicking off this panel. We're actually going to start it off with Eric to talk about what's happening around health equity at the national level. So Eric, I'll kick it over to you.
Thanks, Kendra. And I'm happy to be here today. So some of what I'm going to present will be familiar to some of you based on the poll, but not to all of you. And I think that it's still helpful context to set in order to have a discussion about trends in health and equity and comprehensive planning. So why are we talking about comprehensive plans as a way to improve health and equity? Well, according to the World Health Organization, health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And studies show that healthcare services are only responsible for about 20% of our health. The large majority of our health is determined by two aspects of neighborhoods that together shape our ability to have healthy behaviors. First are all the different elements of the physical environment. And that makes sense because many people only spend maybe 30 minutes to an hour a year with a doctor. And the other 365 days, 24/7, we spend outside the hospital. And so it's really our daily experiences where we live that truly determines how healthy or unhealthy we are. Think about all the different neighborhoods where people live, the centers where people go shopping, the districts where people work, the districts and corridors that are activated by transit routes. Then think about how the physical characteristics are different from one place to another. Do those characteristics support walking through the level of activity, the mix of uses, and the orientation of buildings? Are there trees that provide shade on hot days? Are the homes well maintained and safe? Are there parks and plazas where your child or you can safely play, exercise, relax, or socialize? Are there places to get healthy food? Can an elderly or disabled person get there and do a variety of activities without getting into a car? So one way to think about improving health is to create healthy neighborhoods, which are places that contribute to physical, mental, and social well-being. By thinking about neighborhoods in this way, you can see how these place-based differences contribute to different health outcomes because some neighborhoods support healthy living and other neighborhoods have built environments which make it much more likely that people will have a variety of health challenges. So as Kendra alluded to, over the past 10 to 20 years, municipalities across the country have worked to create healthy environments through comprehensive plans across the country. Early examples typically pointed primarily to obesity rates and used the framework of healthy eating and active living to shape policies. More recently, that perspective has gradually broadened to include the many other ways that our environments influence our health. But it's not just the physical characteristics of places that make neighborhoods different. The second aspect of neighborhoods that shape our health are social and economic systems, policies, and norms. So wealth or poverty, community cohesion or trauma, clean or contaminated water, safety and high rates of violence, transparent decision-making and inclusive community engagement versus processes that limit meaningful participation. These are all experiences that have a profound effect on people's health and behavior. And these experiences are unhealthy in different neighborhoods because systems such as laws, policies, and regulations have shaped them that way. Examples include redlining maps and financial practices that barred neighborhoods deemed, quote, too risky from financial investment because they were too Black, brown, or immigrant. Restrictive covenants that explicitly prohibited residents of color from owning homes. Freeway construction that demolished neighborhoods of color or isolated them from the rest of the community. Blockbusting practices where real estate agents convinced white residents to panic sell and then resold homes at higher prices to families of color. Downzoning density in white neighborhoods while upzoning density in poor neighborhoods of color. Predatory lending practices of promoting risky subprime loans to people of color and poor regions, and many, many others. So people may live in these unhealthy neighborhoods not because it's their choice, but because of social or economic position or other circumstances beyond their control. For example, the neighborhoods where the discriminatory laws, policies, and regulations that I just mentioned have resulted in high concentrations of affordable housing. Those neighborhoods also have high concentrations of residents that are poor and people of color. Less than 1/3 of the US population is Black or Hispanic, but these groups represent 4 out of every 5 people living in metropolitan concentrated poverty across the country. So when these neighborhoods also have physical, social, and economic barriers to health, then low-income residents and residents of color will disproportionately and unfairly be exposed to those unhealthy environments, increasing their risk of poor health, poor education, low income, and poverty. For example, families in neighborhoods such as Park Heights, Baltimore are predominantly non-white and can face overwhelming odds. With less wealth, income, and education, and higher rates of violent victimization, adverse childhood experiences, and chronic diseases, a child born in these neighborhoods can have as much as 20 years shorter life expectancy than a child living 5 miles away on the other side of the interstate highway. Now, the details may vary, but these inequities can be seen in pretty much any community across the country from urban to rural. Over the past 5 years, and especially accelerated by the pandemic, communities are increasingly recognizing the importance of structural inequities and discrimination, as well as shifting their planning activities upstream from just physical environment to systemic issues and broadening goals from just health to broader equity. So equity is when no person is disadvantaged in attaining their full health potential because these types of systemic and structural reasons. And environmental justice is treating people of all races, cultures, and incomes fairly with respect to the development, but also adoption, implementation, and enforcement of policies that determine how healthy or unhealthy different neighborhoods are. In order to achieve health equity and environmental justice, we need to continue to move upstream to dismantle those historical forces that have caused these inequities, such as structural discrimination, income inequality, disparities in opportunity, disparities in political power, and governance that limits meaningful participation. And this brings us to comprehensive plans, which are powerful policy tools that can help align municipal actions around the social determinants of health and turn inequitable systems into equitable ones. And they can do this by integrating health and equity perspectives into your assessment of what's happening today, into your community's vision for the future, and into the full range of actions, projects, procedures, and decisions that county and local governments make along with agencies, institutions, and private partners across sectors, all together to create healthy and equitable communities. So for example, the state of California, knowing that California is its own animal, recognizes the role that comprehensive plans can play in addressing health and equity. So the state now requires cities to address environmental justice in their general plans, which is their name for comprehensive plans. And the objective is to reduce the unique or compounded health risks in disadvantaged communities. And there are 3 steps to do this. So even if it's not a state mandate, communities looking to plan for health and equity can take these same steps. First, define what a disadvantaged neighborhood is based on a combination of the physical and environmental conditions and population characteristics that are present in different neighborhoods. So this includes neighborhoods with disproportionately high barriers to health from a place-based perspective, and neighborhoods with concentrations of people that are of low income, have high unemployment, have low levels of home ownership or high rent burden, sensitive populations, or low levels of educational attainment. And note that the term disadvantaged community is not what's important here. So you can calibrate that to your local context from a communication perspective. Once your disadvantaged neighborhoods are defined and identified, a community needs to understand the compounded health risks that exist in those neighborhoods. And finally, the city can draft policies to address a range of health equity or environmental justice goals. So integrating health and equity perspective into a comprehensive plan is about more than just the content of the policies. And every conversation I've had with planners across the country over the past 2 years, and in every comprehensive plan that I see that has meaningful focus on health and equity, community engagement plays a central role. Planners are responsible not only for managing the outreach process to ensure it's equitable and inclusive, but planners are also on the front lines, and they're the ones who have conversations with community residents and must work to build a trusting relationship between the city and those residents. So there are now examples of equity and comprehensive plans across the country. The growth strategy in Memphis's comprehensive plan is based on priority neighborhoods that were defined using an equity lens. And within those neighborhoods, strategies are built on a framework of community identified assets or anchors. Inclusive Dubuque in Iowa is a local network of community leaders that includes city representation, and it's dedicated to advancing justice and social equity. The network prepared a community equity profile that informed comprehensive plan policies, and equity is woven throughout that plan. Minneapolis's comprehensive plan is organized by both goals and topics. And this is an effective approach to integrating equity throughout a plan by creating a way to identify policies which address health or equity, but are actually located in different chapters, and then collecting them in a single location. A similar approach was taken in Oklahoma City's Plan OKC comprehensive plan to integrate health throughout that plan. Minneapolis's plan includes goals such as eliminate health disparities and equitable civic participation. And civic engagement is based on a set of city-adopted core equity principles. Denver's comprehensive plan has an equitable, affordable, and inclusive element, with health and equity also woven through other elements. And the city also worked with the health department to create an equity atlas, which the planning department uses to prioritize where to allocate resources for planning and investment. Finally, Seattle prepared a growth and equity analysis that was used to shape their comprehensive plan's preferred pattern of growth. And equity is woven throughout that plan as well. And then the plan's equity-oriented growth strategy and policies have filtered down into neighborhood planning efforts, including neighborhood snapshots that provide an overview of neighborhood conditions based on feedback received from community engagement. And finally, I want to provide some perspective for all our expectations. Our research shows that equitable decisions made by elected officials and coordinated by staff across departments through comprehensive and citywide planning will result in equitable plans, programs, and processes. And when implemented over time, that will lead to systemic change. But know that this kind of change also takes time. For some case examples of that, on Richmond, California, Denver, Colorado, and Seattle, Washington, you can see our article, The Long Road to the All of Health and All Policies. So, in closing, just if you want to learn more about anything that I presented, much of this content is based on a couple of Change Lab resources, our Blueprint for Change Makers, our Long Range Planning for Health, Equity, and Prosperity Primer, a Planner's Playbook, a blog on place-based health disparities, and our Health and All Policies resources. And we also have a large library of toolkits, guides, model policies, and other resources that are focused on specific social determinants of health, such as complete parks, complete streets, healthy housing, healthy food retail, worksite wellness, and school wellness. So with that, I will pass it on to Lisa.
Thanks, Eric. Lisa, just to say, I forgot to say this from the beginning is, we do have tons of time in this for questions from the attendees. I know there's around 20 of you on this, so we are going to be using the chat for questions, and Nick and myself will be filtering those over to the panelists. So hold your questions till the end, and we'll use chat and get them over to the panelists. And sorry I didn't say that from the beginning. And with that, I'm going to hand it over to Lisa, because Lisa, I know when Eric says, and we can share slides as well, so he can share his slide deck with you afterwards. Lisa, I know Bonners Ferry has been on a journey over the last couple of years of incorporating health into city planning. Can you share a little bit about the city's journey to embrace health equity in comprehensive plans?
Sure, and thank you all for the opportunity to be here today. It's really a phenomenal time to be in front of the state talking about the work that the Blue Cross Foundation has been doing with communities across the state, and the what I call BHAG, big, hairy, audacious goal that we've been talking about with the foundation about folding in community health as a means to extending this opportunity of engaging our community on all aspects of community health, but in particular with respect to the community transformation grants, which looked at increasing activity levels and access to healthy foods. This was kind of my, what I call aha moment. If you have a chance to go through that granting process, they'll ask you along the way, what were your ahas, or what are your ahas? And this was one of those. So as far as the city of Bonners Ferry is concerned, we went through the community transformation grant. We were a recipient back in 2017. And from 2017 to 2019, we went through a process of engaging our community to learn, well, what does community health mean to the residents and to the business owners and the leaders. And what we learned as part of that was there was so much to do in this area and only a limited amount of funds that could really make an impact. And I like to think of it as rather than throwing one large rock into a pond, thinking about the synergy that comes along with throwing many little rocks. So we really started thinking about, well, how can we make these funds go a long way, and how can we make the biggest impact that we could do for the community of Bonners Ferry. And my hat's off to the former mayor who really broadened the discussion about community being bigger than just the city limits. So we really looked at the community as a whole, being the whole county, how these nodes of people throughout the county really could benefit from the community transformation grant. And so we looked at really spreading those funds out throughout the entire county. But anyways, when it was all said and done, we only had so much money and so much time. And when I went back to the foundation and said, geez, you've given us in particular Mark Benton's, which many of you have met or had a chance to meet. He's an advocate guru in the area of activating communities. Was he put up a fantastic slide that to this day I still kind of live by, and it was, I call it Mark Benton's community food pyramid, but it really built on how he sees activating communities in the form of like a food pyramid. And at the bottom of this pyramid, he had in there community policy and development as being the foundational premise for really building upon all the way up to the individual level, which was at the highest rank, which would be, you know, your what your individual person or group does to like go to a park or maybe walk on a sidewalk. But the community policy and development really set forth that framework for seeing the community grow into itself. So our process for on the community need was to really shift and think about planning, and we used some of our funds to start that process as a means, as our own pilot program. And then as that turned out to be very successful, we turned back to the foundation and said, can we continue trying? And you guys responded, the foundation responded by saying yes. And I think we'll talk a little bit about the results of that first study with the city of Driggs here. But I don't know, did I answer that question?
Yeah, I know you just went through and like an RFQ looking at incorporating your comprehensive plans. What could you share about kind of that process of starting to think of this as you're starting to rethink of retooling your comprehensive plan and bringing social determinants of health into it?
So the city of Bonners Ferry, working with the foundation, we're doing what I guess we call the second round of the pilot program to study the how a community can incorporate the 5 determinants of health within our comprehensive plan. And as part of that, we went through a process of selection, which we are not quite through that process yet. We've held interviews. We sent out the RFQ. We've held interviews, but it was a bit of a struggle to a certain degree because there aren't any, and like many of us do in the state, we all look to each other and say, well, what did you do here, and how did you accommodate a comp plan rewrite or an RFQ process? Well, there really wasn't an RFQ centered around community health. So we leaned very heavily upon the foundation's role in the community transformation grant, as well as the 5 determinants of health study that you guys put together and folded that into our RFQ. We received 3 applicants and we're going through the selection process now. As part of the interviewing process, we did ask specifically for the consultants to address their or I guess allude to their strategies about how they would incorporate community health. And, you know, and it's an interview. So at this point, we don't have a lot of detail, but we're excited to, once we do make that selection, to see how that process evolves. And I think part of the pilot program really was about learning our way through this. So if the foundation does continue, which I've been told you will, that we can hand off that book of knowledge to the next cohort of communities.
Yeah, thanks, Lisa. You know, I think so many of you on this call, I was seeing who was all on it, know so much that we believe in learning from each other and sharing our best practices down to each other. And I think so much of this is a learning journey for all of us. So I think learning from Driggs, which that's a good leadway into kind of where Driggs was with this and with Logan Simpson, but really hearing from each other as we're starting down this journey of incorporating social determinants of health into comp plans and what does that look like for us. So that's a great handoff over to Christy, who is with Logan Simpson. And Christy, will you share a little bit about the Driggs process and how you engage the community to start to put these pieces into the comp plan?
Yeah, hi. Thank you very much for the opportunity to share with you today. Are you able to see my screen? Okay, great. So yeah, I had the honor of working with the Driggs planning team. Driggs is a wonderful community. For anyone who isn't familiar, it is on the other side of the Tetons from Jackson. So it's on the Idaho side, gateway to the Tetons, as well as Yellowstone National Park, regional ski areas and fishing, and a beautiful valley with an agricultural history. So it was really fun to work with this community and to go down there. They have a population of a little under 2,000, so a little bit smaller community. And yeah, we had the opportunity to incorporate health throughout the entire plan. So I'm going to share a little bit about our approach to doing that. So what I'm going to talk about today is identifying community health barriers. What kinds of things, did we find? What were we looking for? Our approach to community engagement, some of the challenges to incorporating a health focus in a comprehensive plan, what we found, and lessons learned. So identifying community health barriers. We were lucky enough to learn about Change Lab Solutions and use a lot of their resources to understand some of these national trends that we should be looking at. Things such as access to healthcare, employment, housing, natural disasters, vulnerable populations, access to exercise and mental health services. That's just a few. And understanding, what kinds of things we need to be looking for in the plan. And on the other end is a data analysis, kind of at the end there, where you look at, how does that translate into the community's walkability, housing, average commute distance and time, recreation programs, educational facilities, and senior services. Those, again, are just a few examples. And then in between those two is community engagement, where you need to take that example of national trends. What is it we need to be looking for? And on the other side, what is actually there? And then ask the community, translate those things to the community, and then ask them what they see, what they need, and what they're feeling. So as far as community engagement, we did a lot of the typical things like community open houses. We also had a booth at the farmers market to try to catch folks. One of the things with trying to understand equity and health in a community is that you can't just have an open house and hope that you're going to get a good diversity of folks at the open house. You have to work a little harder. You have to go to the schools. You have to go to the senior centers. You have to reach out, to minority populations that might be there, and get in there a little deeper to understand what's going on with those populations that you don't always get to hear from. On the right there, during COVID, we actually had an opportunity to launch a questionnaire. This was not planned, but a really good moment for us to be able to understand health on a greater scale through COVID, because that was one of those disruptors in everyone's life that helped us ask those questions about what are your links to, social well-being, mental well-being, healthy food, and how are those being disrupted? And that gave us a really great lens into community values and the way that systems were processing before COVID and during COVID. So lack of social interaction was the main thing we heard. Lack of access to gyms. In the winter, there wasn't a lot of ability to walk around, and some of the recreation things that people typically did, such as skiing, wasn't available at that time either. Folks were worried about income because so much of Driggs is a tourism economy. And then, of course, there at the end is toilet paper, which everyone probably expected. So I wanted to talk a little bit about the challenges to incorporating a health focus and the solutions that we found. So one challenge is that there's a big difference in related to health issues based on income. Folks who have a high income have different health issues than folks with a lower income. One of the solutions to that is incorporating all feedback. A lot of times we'll send out a questionnaire and we'll say, we heard from the majority of people that this is the case, but it's also pulling from the people you didn't hear very much from and saying, okay, we also heard these other things that are a little bit different, and making sure that you plan for and anticipate those challenges. In Driggs, about a third of the population is Latino and Latina. And so there were some language and culture barriers. Our solution to that was working with the Hispanic Resource Center and having local liaisons translate materials and distribute. So they already have a series of small groups that they meet with. They have a bunch of communication protocols in place. And so being able to tag on to what's already existing really helped, because a comprehensive plan process is typically around a year to 2 years. And that isn't always enough time to be able to establish the kind of trust with the local community that you need. And so being able to work with those systems that are already in place and say, we really do want to hear what your thoughts are, we really do want to serve your communities, is fast tracking to get that trust in place and distribute those. Finally, clarifying that link between a comprehensive plan elements and community health. That can be really hard. You know, I think Eric gave a really great example of so many different ways that the built environment is linked to community health, but that isn't always readily apparent. You know, one example that I like is thinking about folks who don't have insulation in their homes. They're paying more because they have to put more heat into their home because more of it is escaping. And so that is one example where, you know, equity is not being served. So being able to look at those trends in the built environment and link those really helps the community understand how that health component is there and to translate that. So I'm going to give a couple of examples of how we use that national trend, those things that we were looking for, and use that community engagement with the existing conditions analysis in a couple of the different topics that we looked at. For recreation, this map is a parks walkability map. You know, access to open space in parks and recreation is one of those national trends that you need to look at. We looked at a 1/4 mile and a 1/2 mile from municipal parks and saw that there's pretty good coverage. There's a lot of areas in Driggs that at the time of this plan were vacant, and so some of them weren't developed yet. But it does help identify some of those gaps in walking access to parks. One thing that was surprising is, you know, the source of the Teton Valley Community Health Needs Assessment. About half of Teton County has access to exercise opportunities. And so that likely counts, you know, a recreation center or a gym and being able to work out inside in the winter. And that is quite a bit lower than the Idaho average. So one of those things that was unexpected, you know, you think, oh, in Driggs, everyone is recreating all the time. But considering that in, you know, different seasons that might not be available to everyone. And then there's some of the things that we heard from the community, kind of bridging that gap between the national trends, the existing conditions, and then what we heard, those quotes, you know, people wanted to provide a safe, healthy recreational opportunities for different ages, like school-age kids, and improve trails maintenance and connections. Findings for the economy. While Driggs has a really fun, vibrant downtown, there's not quite as many people working in that downtown as other communities. So Ketchum, with a slightly higher population, has about 23 employees per acre, whereas Driggs currently has about 9. And so that highlighted an opportunity to increase the employment density downtown so that people could live and work in their same community and not have to commute. One of those things that we looked at from Change Lab Solutions was there's a high number of people that commute for work, and being able to find resources that directly tie that to health was really helpful in the plan to make those connections about where employment, increasing employment density in the city can help overall health because people don't have to spend that extra hour commuting. So other things that we heard from the community are diversifying the local economy, implementing a livable wage, and promote tech business maker spaces and business incubators. For housing, one of the things that we like to look at is cost burdened. For anyone who doesn't know, being cost burdened is where you spend a third of your income or more on your housing. So only about 16% of Driggs homeowners at the time were cost burdened, but 42% of renters were. So that really helped us see the trend with the renting economy and the renting inventory in Driggs, and where the housing recommendations and policies might be able to help with that. Some of the things we heard as part of this were address housing prices and seasonal over-tourism, improve regulation of short-term rentals, and creating an opportunity for more long-term rentals. And then the environment. This is a map here of Driggs. You can see it's surrounded by a lot of rich environmental resources. It has the mountains and to either side, and then great agricultural lands in the valley there. A lot of what we heard is, a lot of pride in that environment and a lot of connection to health and the environment, both economically, physically, every way, so being able to monitor that environmental health and link it to community health was really important in the plan as well. So some of the things we heard are the desire to become a model of sustainable community in the greater Yellowstone ecosystem and expanding environmental awareness and practices. So the overall findings, for recreation, some of the main takeaways were the desire for an indoor recreation options and trail and path connections, and those became highlights of the plan. Housing, the need for long-term rentals, and the need for workforce housing infill. For the environment, environmental health is economic health, for so much of that tourism industry, especially if there is something that happens to the water system and then the fishing economy, that does have a direct impact to, the overall community health and well-being. And anticipating natural disaster and health support. So, we've had a lot of fires, as everyone knows. Being able to understand, how that is impacting community health and trying to anticipate what can be done, if anything, or just trying to anticipate, that there may be needs for more health support in respiratory systems within the community. And for the economy, diversifying the economy to reduce reduce commute time, diversify the workforce, and stabilize income in times of booms and busts. So lessons learned. We learned a lot throughout this process. We've incorporated health in other plans, but being able to give it so much importance in this plan really gave us some lessons learned to move forward in other plans and in Driggs. So one is start early and engage minority communities as early as you can. Start finding who those liaisons are, who those groups already are, and start figuring out ways to communicate with those communities and engage them in the process. To connect the built environment with health throughout the process and the plan. So in our existing conditions, in our public outreach, in everything that we did, we tried to incorporate that health focus and tried to make those connections so that people could see how they're related. And then 3, take opportunities to learn about community health in different ways. So, COVID happened and we had the opportunity to send out that questionnaire specifically about how that was impacting their lives, which helped us see some of the larger trends throughout the community. So yeah, that is really how we approached the health equity and health in the plan. And I think Leanne will next talk a little bit about moving the plan forward.
Thanks, Christy. I appreciate it. Leanne, before we jump over to you, Christy, I think something that really struck me that Eric also pinged me on was working with the liaisons and building that trust. I know, Eric, that's something that Change Labs really focuses on as well. Can you comment a little bit on that, of like building trust within the community with all populations?
Yeah, the thing that struck me from your presentation that I wanted to highlight as it relates to, broader trends and some of the like more theoretical thinking that we've done and seeing what's out there, especially as it relates to equity, is just to like really critically evaluate how you do community engagement and to identify the gaps. So you can see some of the lessons from this in terms of like starting as early as possible, like little things, which I know that, a lot of you on this call may have done, which is you do a community workshop, you have some breakout groups and you have some conversations. And then the result, the summary of your workshop is like a synthesis of what everybody said in a way that takes out some of the actual individual feedback that you may have received in order to talk about consensus building. But like that individual little feedback you received is part of that issue of equity in terms of community voice of those individuals who actually had something to say that may not have been consistent with like the broader conversation in that discussion. And, in terms of trust in particular, just really reflecting on the fact that it takes time. Think about your just an actual relationship with anybody, whether it's work related or not, and how long it takes for you to like feel like you know who that person is and like you can trust them and you have a relationship with them. Like community trust is the same thing. And so while there are aspects of that you can use comprehensive planning process to help build that trust and to work to be more inclusive in your engagement activities, I think another like a highlight for me out of this that I've seen in other places is to actually think about community engagement as something that's separate and disconnected from any specific project. It's an outcome and a process that cities need to do with the residents of their communities in a more like ongoing and comprehensive way. And those ongoing conversations are the ones that build the trust and that can give you information that will ultimately shape any particular policy process that you engage in. So like some of the things that you noticed on her slides when you was like, these are the things that the community said when we were talking about housing, like they have broader issues on their mind and they have things that they want to talk about and experiences they're having that may be hard to fit into like a specific project about a streetscape or even a comprehensive plan. And you need to have broader ways to hear those things from residents.
Great, thanks, Eric. So with that, Leanne, let's hand it over to you and see a little bit about what did the Driggs plan look like.
All right, thank you, Kendra, and thank you all. Let me just share my screen. All right, can you all see that? All right. So again, thank you for having me. Again, my name is Leanne Bernstein. I'm the Planning and Zoning Administrator here with the City of Driggs. So I was lucky enough to be tasked with the update, which ended up being a complete overhaul of our comprehensive plan. So we started the process in earnest in May 2019. That's when we got Logan Simpson on board with the hopes that we would adopt a new plan in the summer of 2020. With everything that went on that year, we were delayed a little bit. We were able to kind of reorient given the circumstances around COVID, and we did end up adopting our new plan in November 2020. So we're coming up on about a year out from adoption. So first, I just really want to acknowledge that the funding provided by the Blue Cross of Idaho Foundation really enabled the City of Driggs to work with qualified professionals at Logan Simpson. As Christy said, we're a pretty small city, people-wise, population-wise, and staff-wise. So this extra resource really enabled us to, again, work with the folks at Logan Simpson, bring in their expertise and extra people power. So we were able to pursue a much more robust outreach and community engagement program. We were able to increase engagement, hold more workshops. We were able to go into high school classes, as Christy said, translate all materials into Spanish. And I think we were also able to adjust much better than we would have if we were just city staff on our own to the limitations around COVID setting in. So we were able to come together between Logan Simpson, what they brought to the table, and city staff to combine top-down knowledge and information, the national trends and perspectives, the information that Logan Simpson found for us from Change Labs, kind of integrating that. So bringing that all together, and then bringing in the local knowledge and context from city staff, elected and appointed officials, the local community, and then a local comprehensive plan committee that we convened as well. So with this help, the process was so much more thorough than it would have been otherwise. And the end product was just a better quality all around. On the slide here, I just have our first I guess, cover page of our plan. I've got a couple slides that I wanted to share. Not really hoping that anyone will be able to read anything on the fly, but just to kind of show how we integrated health and health equity into our plan. So Christy outlined a lot of what we've heard from the community. So I wanted to show what that actually looked like in our end product. So the plan is broken up into 3 parts. Part 1 being a background and kind of existing conditions. Part 2 being the section that covers all of the elements that we're required to cover by state statute. We kind of tidied them up into 8 different topics. And then each of those topics has their own visions, goals, objectives, and actions. And then in part 3, we cover land use, implementation of the plan, and a monitoring program for the plan. So up here, I just kind of have a summary of those 3 parts, and then the beginning of part 2, where we've outlined all of the topics that we cover. So I also want to point out on this first page of part 2, the orange box, which is called out as a closer look at health. So this is how we kind of pulled out and emphasized in health and health equality in our plan. We didn't pull it out as a separate section. We incorporated it into each of the overarching sections and topics. So each of the topics has a closer look at health call out box within it. So I just wanted to pull out kind of example of what this looked like for one of the topics. I just chose our unique environment. So you can see that this started out, or the section starts off with just kind of some background information, relevant graphics, and we included a closer look at health call out box. This section on the environment also then, as I said, goes into explaining a vision for our unique environment, goals, and then objectives and actions. Again, I'm not really hoping that anyone can read this. I'll share with everyone a link so you all can go ahead and see our complete plan if you are interested in seeing, how this played out and look a little bit deeper into the plan. I just wanted to kind of show how it's laid out. Each of the topics, as I said, has these action items, which are very well organized, and each have a listed priority level. So that's the number in the parentheses at the end of each action item. So that kind of helps guide priorities, top priority being 1, 2s being slightly lower priority, and 3s not necessarily being the lowest priority, but 3 was indicating that it's probably an ongoing action that doesn't really have a good start or end to it. So then I just wanted to pull out kind of what this closer look at health call out box looked like. So for the environment topic, we called out risk of wildfire, the effects on air pollution, and the implications that might have for everybody, but particularly for vulnerable populations. So we included a little bit of kind of perspective and background information on that, some sources of information, and some things to consider. And this is really the piece where it's helpful to bring in broad, national information and then distill it down to, what does that mean for DRIGs? For other health callouts that we included in the other topics, they included topics like providing quality and affordable housing. Of course, we all know that the absence of that, as we've already stated, can cause high levels of stress in everybody, including children. The effects of long commute to go to work on your health. As a small rural community, we've got a lot of folks that commute. Actually, incidentally, more and more these days, we have folks commuting into DRIGs from further and further away. We also have a lot of folks in DRIGs that commute to places like Jackson for work. Access to quality parks and different types of parks and recreation, and especially an emphasis on access to recreation options, even in the winter time. We are a place that gets a lot of snow, which might make it pretty difficult for someone to walk outside of their home and try to find a safe way to exercise. Access to healthcare, particularly important and sometimes tricky in rural areas. We are lucky enough to be the home base for our regional hospital here, but we summarize considerations for things like language translation for health services, and also, winter access to services if there's some sort of crisis. Also during a snowstorm, ensuring that folks can get to those resources that they need quickly. More generally, increasing safe pedestrian connectivity throughout the city. We do have an airport here, so we looked into compatible land uses around the runway and noise. And with urban design, we focused in the health call out on the benefits of street trees. So again, working with the team at Logan Simpson and working with the kind of broader information, particularly information provided by Change Labs, helped us to incorporate a broad picture of all the comp plan topics, as well as national trends and information. We were able to work together with them and our local community to bring more of a bottom-up perspective on that and be able to digest this kind of bigger picture information into what it really means for DRIGs. So we've also included in the plan a monitoring plan. So this is just one of the pages of the monitoring plan. It happens to be focused on economy. But the hope is that in keeping the comprehensive plan a living document, we're looking to monitor its effectiveness continuously. So a monitoring plan is included right in the document. It includes indicators and metrics for many of the topics. And then we can track changes over time. And it does actually call for an assessment of these indicators and metrics about a year and 2 years out. It also includes corrective actions that we can take kind of depending on the direction that things are going. So as I said, we're almost a year out from the original adoption of this plan. So we are going to be hopefully digging into this assessment sometime soon. But as far as implementation so far and kind of what we've been doing with this plan since, shortly after we adopted the plan, we held work sessions with our elected and appointed officials. We listed all of the action plans that I showed just a couple slides ago. We took them all from the different topics. And as I noted, they do have priorities listed in them, but we essentially asked our decision makers what they viewed as priorities to help kind of distill some things and see what floats to the top as far as what we should be working on sooner. So we were able to have some conversations around that. And we have started to implement some of the recommendations in the comprehensive plan. Of course, the comprehensive plan is always reviewed whenever there's a proposed development on the table. So that having an updated comprehensive plan these days where we're seeing just a huge increase in development has been just incredibly helpful. We've also been able to point to this to make some updates to our land development code to support some of the objectives in here. And then we also took those priorities that floated to the surface from our decision makers to start to figure out how we're going to dedicate time and resources to pursuing some of these things. Obviously, some of them have direct implications for things like land use and development proposals, and others have more direct implications for, just things that the city wants to focus our resources on. So one of the biggest takeaways, which it feels so, it just makes so much sense now. We know that all of the topics that we're required to cover in a comprehensive plan, we know that they're interrelated, but we divide them up into sections anyways, because that, I don't know, maybe it's easier to digest. But seeing how health and health equity are so intertwined into all of these more broad topics, I think was one of the greatest benefits of taking this approach and putting it under each topic instead of pulling it out on its own. Additionally, kind of the repeated considerations for health in each topic is a constant reminder of the impacts of planning and land use decisions on various social determinants of health. So my hope is that, because it's kind of iterated in multiple places in the code, is that it continuously reminds and also empowers decision makers to consider the impacts of their decisions on health and equity, and to support actions that work towards increasing health equity. So yeah, moving forward, like I said, I've got a link here in case you are curious to see the entire plan, see what the rest of it looks like. You'll also be able to find my contact information there if you're curious about the process. But we are super curious to see how other communities pick this up and decide to run with it. Through this process, we learned a ton. We had to learn a ton. So we also know that there's room for improvement. There's room to keep this document alive, to keep on learning, to keep it relevant. So yeah, take a look at it. Stay in touch. I really am excited to see where other communities hopefully take this and run with it. So with that, I think I'll turn it back to you, Kendra.
Thanks, Leanne. I know I appreciated this. Is definitely a learning journey. That's what I was talking about from the beginning, as we start to think about how our zip code impacts health. And so much of what Eric said in the beginning really resonated with me, is like, health doesn't happen in a doctor's office, right? It happens in our communities, and our zip codes do predict our health. So starting to look at all aspects of the community and the social determinants of health, and how can those get woven into a comprehensive plan. So with that, we're actually going to start opening it up for question and answers. I know there's already a couple that have trickled in. I'll start with the first one. It's asking, does the Blue Cross Foundation have resources for health impact assessments for planning and local policy decision making? We do not have specific resources, but I did kind of behind the scenes ping Eric to see if Change Labs has resources related to health impact assessments. And Eric, I can kind of point that question over to you.
Sure. So we don't have, in terms of the types of resources we have, which would be like guides or toolkits, we don't have guides or toolkits on health impact assessments. But what I think I can say is to provide a little bit of like high level perspective on health impact assessments as a tool related to what it is we're talking about. And I think I would say not just health impact assessments. So I think the first thing to point out is that this question highlights the important role that public health can and should play in planning processes. So public health departments as important partners for municipalities and planning departments. And for everyone to know that, like health departments gather a lot of data and they track a lot of things that are relevant to the conversations that we're talking about. And to the extent that you're looking at identifying priority neighborhoods or disadvantaged communities, or however you might phrase it, or how it might fit in your community, is that the health differences between those communities is an important part of defining that, and public health is an important partner in figuring that out. And so the tools that public health has that are related here are community health needs assessments, community health improvement plans, and health impact assessments. And the ways that those different types of documents fit into what we're talking about, kind of colloquially, you could say, the community health needs assessment is part of your existing conditions analysis. And the community health improvement plan is part of your selection of strategies and policies. How do you respond to the health needs that you've identified? And then the health impact assessment is kind of like the EIR, the environmental impact report. But it's, it's really a health focused document that's intended to identify health impacts of policy change. And so you can see that as documents and as processes that the public health sector goes through, you can see a lot of alignment with the processes that planning goes through. And making those connections is a good way of spreading capacity and going deeper into what are clearly like comprehensive and complicated topics. And the only other thing I'd say is that the CDC APA has I think a resource or a page on health impact assessments or related, and Pew Charitable Trust I think I've seen has like a resource about health impact assessments. So those are some places that you might start looking in terms of like documents talking about them.
Yeah, and Aaron just sent over another link to the planning.org/national centers /health/planning HIA. So I'll put this over in the main chat too, or I'll try to figure out how to do that. Sometimes I'm not a lot technologically savvy, but I'll get there. Thanks, Eric, for that one. This next one is really, it's around health impact assessments, and this is probably really for Christy and Leanne, is does the DRIGS comp plan call for health impact assessments? If not, why not? If yes, have you done any, and what's the result? So I'll hand that over to Leanne and Christy.
I don't recall if it calls for a health impact assessment. I know that as part of our monitoring, we've incorporated health elements. But Leanne, do you remember any other components?
No, not directly, but the implementation in the monitoring program did highlight some of the kind of easiest things to track, as far as like housing and population growth and development patterns. So those are things that we can see, hard data that we can see, what's changing and what direction is it changing in. And from there, I think we can make some pretty solid conclusions about what types of impacts that might have on health and those other health items, and kind of go from there.
I'm also recalling right now that one of the people on our steering committee actually worked at the hospital, and the hospital was updating the regional health needs assessment. So we were able to use a lot of the information that they were pulling that was 2019, 2020, pre-COVID.
Yeah, actually, oh, sorry, go ahead.
No, go ahead.
I was going to say, actually, with the little that I was involved in this, I remember that too. And so again, just kind of reiterating for those, especially if we have a lot of a planning audience, reiterating the types and uses of the documents and how they were to relate to what we have here. A health impact assessment would have been something that would have been like an assessment of the comprehensive plan to identify the potential health impacts of the policies. Which is distinct from what you do have in the plan, which is also important, and which is a way to track the health impacts of the plan over time. So like monitoring and evaluation and tracking of the outcomes of the plan, which is not a health impact assessment. It's assessing the impact of your policy over time. It's tracking. That just to kind of make that distinction, the one is like a one-time thing to help with decision making around policy adoption, and then the other is the creation, incorporating metrics and specific things that you're going to look at in order to determine whether or not the outcomes that you hoped for are the outcomes that you're getting, and then to be able to kind of adjust over time.
Yeah. Great. Thank you, everyone. There's another question here. We saw where DRIGS folded health kind of across the different aspects of the comprehensive plan versus having it kind of its own standalone piece. So the question is, why was it decided to have it kind of health in all the different aspects versus its standalone? So I'll put that one to Leanne and Christy, but then the follow-up that is I'm going to ping over to Eric is what are we seeing at the national level of how health and health equity is being included? Is it kind of peanut buttered across? Is it more standalone? So Leanne and Christy, we'd love to hear about where was kind of that decision making of bringing health across the whole comp plan versus a standalone?
Yeah, I can start and see how I do it, Leanne. You know, when we started looking at these national trends and we started looking at the built environment and how they're all connected, it just became so obvious so quickly that everything was tied together. Housing and transportation and health and access to, you know, recreation and all of it. And so we actually, I think, made the decision pretty quickly to try to pull out what is that connection just for the economy and what is that connection just for housing. And of course, it's still all very connected as a big web, but just to try to highlight, since the plan was already organized by these themes, how health and policy for those specific themes can be helpful. But yeah, because we started looking at health and it was like, well, this is obviously all tied together. So it made the most sense to be able to highlight it in each theme.
Yeah, and I'll just add on that, like, I think, you know, health is a broader topic, and kind of the items that Eric had provided an overview of at the beginning is pretty clear. But when it comes to, you know, what does that mean for a city and the role of a city, and what can we actually do to help with these and to make an impact in these areas? And it's, you know, it's infrastructure, it's programming, it's the built environment, it's transportation planning, it's all of those pieces. So to pull it out, you know, we don't have a ton, I don't know, those are the things that the city has some control over, or hopes to have control over. So we tied them right together.
Great.
Yeah, so I think the two things that I would say first, from a national in terms of the plans that I see and that I look at, generally speaking, there is content that is woven throughout the plan. Often there is also a specific chapter on it or a specific element on it. And when I am like working from scratch or working with a community to try and make this happen, I typically recommend that kind of both approach. And the reason, and I'll give you an example, is you want to have one place that establishes that health and equity is what you want to achieve. So that might mean like, okay, you have a set of guiding principles, and one of them is healthy community or equitable community. And then you have a chapter which can state a little bit more broadly and specifically, like, what does it mean for your community to be a healthy community and an equitable community? And what are generally the ways that the city is going to approach achieving that outcome? So you might say, okay, well, we're going to achieve health and equity by through some housing related actions and through some transportation related actions and through some parks related actions. It might be because you're looking at outcomes. Well, we want walkability and we want affordability and we want, social activity. And that is the stuff that you're framing from a health perspective in the health chapter, in the equity chapter. But the way that you're actually going to accomplish that is through transportation policies and housing policies and parks and recreation and open space policies and economic development policies. And so those policies, like a complete streets policy, belongs in the transportation section. But you want for the implementation and the health outcomes for it to be clear that one of the reasons that you have this complete streets policy is to get health outcomes, so that when you do the implementation, it's part of your decision-making process in any particular project, that you remember that if, like, tensions come up, or if you have trade-offs, that you include health as one of your decision-making factors around that trade-off of the transportation implementation action. So that's why generally when I talk about it, I talk about a kind of a both approach, where you have one section that establishes what your intended health and equity outcomes are, but then you tie those to your policy activities that are in all the different sections.
Yeah. Thanks, Eric. And that kind of ties into this next question that is also about the DRIGS comp plan is, were there health-related specific goals and objectives, or was there just more containing kind of subtle discussions or considerations around health? I know we can go look it up, but I think that was kind of a question of, is there kind of concrete objectives, or is there just more kind of topics for kind of more higher level considerations?
Yeah, so I think in each topic there are specific actions that point to this. I am sorry, I'm not going to be able to pull up any on the fly, but I think, sorry, I think that they're in there. But I actually really appreciate what Eric stated as far as being a little bit more intentional and clear about the intended outcomes with those health related factors. I think that that's actually something that this plan could really benefit from.
Yeah. Thank you, Leanne. I know this is a learning journey, right? And so I'm just so proud of City of Driggs for wanting to start this and kind of start this work. And even as Lisa, she's starting to look at this. So I appreciate the feedback. Again, we have time for questions. So if there's any other Q&As, throw them. I'm looking at it on my phone right here for everyone to see. So throw in if you have additional questions here. See if any pop through here. Oh, Doug did reply to one of the questions too. Doug Self from Driggs. So if everyone looks at the Q&A as well. Aaron did put in the chat to that other link that I was trying to get to. I think for me, this would probably be a question for Eric, and it's probably a little bit more of a philosophical one, is, I have a public health background. I think it's fascinating how we're seeing this trend move, especially when we think of the social determinants of health, of that they are very much an ecosystem, right? And there's kind of been this movement over the last year of health doesn't happen in a doctor's office. All these other pieces are impacting health. Like COVID really shined a light on that, right? That there are all these other pieces that are impacting health. And I think the equity piece is becoming such a bubbling up more of dialogue too. What do you think is going to be kind of the next steps happening at the planning level of thinking of social determinants of health and planning? So what do you see happening over the next 3 to 5 years moving forward in this space?
So I think the first thing that I would say is, in terms of the trajectory, this trajectory of like health and planning, which going back to like the origins of planning, but the more recent part of the trajectory, which, as I stated, was kind of like a start from obesity and healthy eating and active living and kind of broadly expanding. I think where we are now is that there's generally a pretty clear understanding among planners generally around like physical activity and walkability in particular, maybe a little bit less in terms of food access. But that those two connections between planning and health are fairly, best practice standard to a certain extent at this point. And where we are right now is kind of in the same place as we were when those topics were coming into planning, but with equity and systemic issues. So I think that kind of where we are now is the like relationship building and the level setting in language and the like kind of wrapping our heads around it as an influence on our planning activities. And I think that it won't be too long before we see a pretty good acceleration of those ideas and those thoughts being incorporated into plans in different ways. And, I mean, remember, like, it's a field, so it's really fragmented, but it's also a field that does build off of each other's work a lot. So I think that we will see, as we get more examples in different kinds of communities across the country, I think we'll see it accelerate because of the way that, even though things need to be calibrated, conceptually and theoretically, the issues are the same issues, right? And so the ways that different communities respond to those issues will be transferable to communities that are similar. And then the other thing that I would say is, I don't know how much we'll see movement on this, but I'll just reiterate again, I'm right now, personally, I'm really in a space of recognizing this issue of community engagement. And I think it's fairly front and center in the field as it related, as an offshoot of just, the social justice and discrimination experiences that we're seeing out in the world that aren't necessarily a direct relation to planning, but that the issues of like social and racial discrimination and the ties to our policies, I think are pretty clear to a lot of people in the field, even if they don't know exactly how it translates to what they do on a daily basis. But I definitely am hearing a consistent conversation about people-centered, people first, being more inclusive in community engagement. And ultimately, that's going to translate into some changes into the way that community engagement happens. But I think that there's going to be a lot of iteration and innovation that's going to have to happen before there's before it's more pervasive and more of a standard practice. Because I think it's going to be harder to change the standard practice of, like, we have a policy that we want to update, and so we're going to put out an RFP, or we're going to start a process, and we're going to have some workshops, and then we're going to come up with some policies related to those workshops, and we're going to adopt a plan, and that is still kind of the process, but the engagement just needs to be much more integrated throughout, and it needs to be more upfront, and it needs to be more comprehensive. And I think people recognize that, but the actual operationalization of it is going to be something that's going to be hard because it takes time and resources,
Yeah, thank you, Eric. I know one of the last questions, someone's already ahead of me. I was going to talk about the grant, so let me share my screen here. Let me pull it up. Give me a second. But I got all the bars up here, so I can't start the just a sec. I got to move bars around to where I can start the slideshow to where you're not seeing all my. Okay, so what is this grant? We want to continue this. I feel like we've had enough movement. So we're working with Driggs and the City of Bonners Ferry that we are launching another grant, so an RFP, of incorporating social determinants of health and health outcomes into a city's comprehensive plan. It's open on our website. You can go to bcidahofoundation.org. It should be on the main website that you can click on it. Any city can apply. The award amount is up to $50,000. So it's basically to kind of help you enhance the engagement process, bringing some of those pieces in. And very honestly, we stay very hands-off because we don't want to influence your policy and what it looks like. We just simply want to help you dig deeper and make sure that everyone in your community is included in this process and that their voices are heard. So the RFP is open. The application deadline is December 1st at 5 p.m. Mountain Standard Time, and we'll be announcing awardees mid-December. And we have a 2-year time frame for completing the comprehensive plan. So knowing that this takes time, and don't feel like this is a one and done thing. So much of this is timing. So if the city, if your city's comprehensive plan isn't up for review right now, that is totally fine. This is all about a timing thing. So we're going to continue doing this work. We're committed to doing this work. So again, this is just kind of one of probably multiple years moving forward of us, helping communities look at the social determinants of health in their comprehensive plans. So this is not, so don't be panicked if, like I said, if this is not the right time for your community, that is totally fine. But for those of you that this may be good timing and have an interest in this, we'd love to see you apply. So And for me, I just have to cap it off. COVID, as a public health person again, COVID has shined such a light on me, for me, of going back to the history of public health and its intersection in community design, because the birth of public health was actually around infectious disease, right? And because of that, and starting to come together, we have waste disposal, sewer, all these pieces now, clean drinking water, that was all really the history of public health and community design starting to come together. And we're kind of seeing this full circle, I feel like, we are in an infectious disease right now, but we're kind of coming this full circle of even around these chronic diseases, and then the things that we're seeing of how our zip code predicts that, and the environment's role in that, and the community's role in that. And I think it's really exciting to kind of come this full circle. I know that some of you that have done some of our workshops in the past have heard me talk about that, of there has always been this intersection between health and community design. And I love that it's coming back around to start to think about it again. And every time I, turn on the faucet and think of our clean drinking water, that was the intersection of public health and cities coming together in design. So that's really pretty cool. So I want to thank everyone for attending today. This was a great session. I learned so much from our panelists. I have to thank all of them for spending their time and all the insights that they provided on this. So thank you, Eric, Lisa, Christy, and Leanne, for their awesome information, and for the close to 20 of you that attended in. We appreciate it so much. So thanks, everyone.